Okay, we're going to get started. If everyone can find a seat. There's still a few seats in the front. I know sometimes people don't like to come down front, but there's still room. And also just a note to students, if you came in and you did not swipe your Royal card, the reader is out there. It will be out there until the end of the event as well, so make sure you do that before you leave. So welcome. This is our third and final community-based learning talk, or CBL as we call it, of the spring semester. My name is Julie Schumacher-Cohen, and I serve the university as Assistant Vice President for Community Engagement and Government Affairs. I'm really glad to welcome many students who are in the room tonight. I know many of you are here for your community-based learning opportunity for the spring semester, but I'm also mindful that we have many guests as well from the Scranton community and faculty and staff. So glad you are all here this evening. Tonight's event is a collaboration of the Community-Based Learning Office, Community Relations, the Penobscot College of Professional Studies, and also the two agencies who will be presenting this evening, McAuley Center and United Neighborhood Centers. We have two wonderful speakers who are with us tonight, two community agency colleagues, Krista Murray and Jessica Wallo, and they bring vast experience and expertise to what are, I think, urgent and timely issues in our community. And my colleague, Daisy Corretto, Assistant Director for Community and Civic Engagement, will be introducing our speakers in just a moment. We've had a really wonderful slate of CBL talks this semester. So those of you who may not have come, we talked our first talk was on the health disparities in Lackawanna County, and we had agency colleagues from the Lackawanna Health Department, that's in formation. And then we also talked about immigration and diversity. And we had Jenny Gonzalez from the STARS program, after-school program at Marywood. So thinking about all different issues that are, that we're trying to address and that our community colleagues are addressing in different ways throughout the semester. Tonight's topic is the root cause of homelessness and poverty in northeastern PA. And again, we know that these are important issues here in the Scranton area and also throughout the nation. And as we focused on here, we want to explore the root underlying causes so that we can really best understand how to achieve humane, empathetic, compassionate solutions as we consider the needs in our community in a holistic manner. A little over a year ago, the university released its latest living wage study. Some of you may be familiar with that, and we'll probably send some links as a follow-up. But this is a study that we do every 3 years that kind of is a sort of thermometer of what are some of the socioeconomic trends and what are some of the challenges facing the community. It's rooted in the Catholic social tradition of solidarity and economic justice, and in it we highlighted some of the problems that are sort of the backdrop of what we'll be discussing tonight. We identified what it takes to make a living wage, which is what is needed to live a modest but dignified life in our region. But that has gotten harder for people. That has increased. That our regional median household income falls below what is needed for families to thrive. That we have a higher poverty rate here in our region than when we look at other parts of Pennsylvania. And that the need for different services has increased in terms of the community social service agencies that are, folks who are coming to them, and we're going to hear more about those kinds of challenges. And also that households are struggling with rising costs for especially affordable housing and different basic needs. And we're also very aware that all of those issues have disproportionate impacts on different communities of color, on immigration, on immigrant and refugee groups, as well as those who are recently re-entering after having served in prison, so formerly incarcerated population. So all of those different disproportionate impacts. And I also wanted to mention that in our recent Scranton Stories project, we're not going to be highlighting that tonight, but we can send that as a follow-up, that we also looked at, we had about 25 oral histories, about 33 interviewees that were focused on throughout the community, and a number of them also shared some stories related to economic struggle, including finding themselves unhoused. So those are stories that are available, and again, really help to bring, I think, a human face to these problems and really help us to connect with our neighbors and to better understand these kinds of issues. So again, we are very grateful to have two speakers with us who know these issues, whose agencies are working on these issues, who are very connected to different vulnerable communities, and to share with us this evening some of their work, and then to open it up to have Q&A from all of you, and we will end right around 7 o'clock. So I'm going to introduce now Daisy Corretto. She is just newly joined the university, but is not new in the community, not new at the university. She's a past Royal, having graduated here and also come from social work. So Daisy has put all the CBL program together this semester, and she's now going to introduce our speakers. Daisy.
Can you hear me a little bit? Okay. All right. Good evening, everyone. We're so excited and delighted to welcome our students and welcome our neighbors, community partners. Welcome. My name is Daisy Corretto, and I am thrilled to present our speakers for this evening. Krista Murray is the Executive Director of the McAuley Center. As Executive Director, Krista leads the McAuley Center, calling on her previous nonprofit management experience at the Lehigh Valley Health Network, the Alzheimer's Association, Wilkes University, and the Arthritis Foundation, her New York University psychology degree, and passion for empowering women and creating a home in NEPA. Krista oversees the operations of the center and develops strategy to continue to serve the NEPA community. Krista currently serves as a board member for the Scranton Housing Authority, the Scranton-Lackawanna County Continuum of Care, and the NEPA American Cancer Society Advisory Board. She is a fellow of the Aspen Institute as part of the NEPA Workforce Development Academy. Krista is proud to call Scranton her home and lives with her husband and 2 children. Jessica Wallo, Director of Community Services, has been with United Neighborhood Centers since 2009. She started as an HIV/AIDS prevention coordinator before becoming a case manager in the Community Services Department in 2011. She was promoted to Emergency Services Supervisor in 2013 and then Assistant Director of Community Services soon after. She holds a master's degree in General Theoretical Psychology from Marywood University and a bachelor's degree in psychology from King's College. She is a Ronald McDonald House of Scranton board member and a volunteer with UR-365. Please join me in welcoming Krista Murray and Jessica Wallo.
Hi everyone, it's great to be here with you tonight to talk about homelessness in Northeast Pennsylvania and what some of the root causes and what it looks like right here in our backyards too. So like Daisy said, my name is Krista and I am from the McAuley Center, and I'll just give you a brief overview of what the McAuley Center does. We offer services to those experiencing homelessness in Lackawanna and Luzerne counties, largely through our emergency shelter for families programs. We also do our family support program, which offers counseling, strengths-based case management to focus on prevention of homelessness and prevention of eviction. We have rapid rehousing and permanent supportive housing programs that offer case management and rental assistance to those experiencing homelessness to help them increase their life skills and get back on their feet after their episodic homelessness experiences. We also have a prison reentry program for incarcerated women, a food pantry, and a period project that provides menstrual health supplies to those in need.
Hi everyone, my name is Jessica Wallo. As Daisy mentioned, I've been with United Neighborhood Centers for 15 years. Previously, I spent a year of service working at the South Bend Center for the Homeless, and being able to really find out that working with the unhoused population is my passion and something that I feel like I'm called to do. United Neighborhood Centers has been in existence for over 100 years now, which is really powerful. We currently house multiple various departments in Lackawanna County to serve those who are in need in a variety of different ways, including workforce development, English classes, children and teens programming, senior centers. We have some health navigators. And in my department, we tend to primarily serve those who are in poverty and those who are in crisis. So those individuals who they don't know where they're going to sleep tonight. They're not sure of the direction to go. They don't know which door to approach. They can come and speak to one of our counselors. We do have a food pantry and clothing donation room. And just a little plug, if you need service hours, we're gladly accepting volunteers for service hours. So just to put that out there. And our mission is to work together with neighbors to provide services and create opportunities that empower individuals and build strong interdependent communities. And I really do think that we embody that mission. So we just wanted to start off our presentation with a quick video of somebody who you may recognize. He's pretty popular in Hollywood.
Are you and have you been addicted to any legal or illegal substances?
You are was really still.
How about family? You got family?
In Time Out of Mind, George, a homeless man, is an enigma. We learn nothing about his background that could explain or justify his current state of being. Instead, we follow him around in his day-to-day struggle for survival. Actor Richard Gere, shabbily dressed and with a botched haircut, transforms himself into a wreck of a man.
So wake up, all right? You're in the emergency room. You okay?
This was a movie that was going to call attention to a person you would ignore in real life.
Filmmaker Oren Moverman used long-distance lenses to shoot scenes where a lone Richard Gere, immersed in his character, was panhandling in the middle of New York City. The results were startling.
No one was paying attention. And there was this feeling of invisibility. But that wasn't really the depth of the experience. The experience was in fact more like a black hole. It was that people did notice me, but they didn't want to get close. And not just physically close, they didn't want to get emotionally close.
The film shows that it does not take much for someone to end up homeless. It also reveals a world of shelters driven by bureaucracy, but also filled with compassionate social workers.
I was on your side of the glass once. Okay, you'll stay here tonight in a bed. Okay, good. We'll evaluate you. If you qualify, you'll be assigned to permanent shelter.
A what?
A place where you could stay.
Permanent?
Richard Gere hopes the film will help galvanize support for displaced people the world over.
All displaced people, refugees. What we're seeing in Europe and the tension of these millions of displaced people looking for home. Where is my home now? My home is gone. Am I homeless? Am I homeless? I'm homeless.
Gere says being homeless makes you question your very own existence because he says no one acknowledges your presence. Although not homeless himself, he felt the impact of homelessness firsthand.
So, a movie star being homeless. So it was a profound experience. This first day especially.
You don't like yourself, you're depressed, you don't believe in yourself. So what's society supposed to do with you? Why should they care?
Time Out of Mind shows us why. Penelope Pulu, VOA News, Washington.
We just wanted to show that video. Somebody relatable, right? Somebody many of us may have. Okay, thank you.
Professor John Nash, very welcome to this interview.
That is not part of this presentation.
Could have been worse.
It could have been worse. We just wanted to show somebody relatable, somebody that, I mean, not necessarily relatable, but somebody familiar, right? Somebody that many of us have grown up seeing in film. And I had seen him actually speak at a conference to talk about his experiences. And he said he was outside for, I want to say 45 minutes, and he was dressed in character so that he can get into character. And he said one person did stop and recognize him. But the one thing that was so profound for him was that somebody came up to him with a slice of pizza and offered him that slice of pizza and sat and talked to him. And I think that's what one of the things that Krista and I kind of want to bring home in our presentation tonight is the act of empathy and compassion and recognizing the human dignity in individuals, and that although these people that we're seeing may not resemble us, we could be there too, and that they do deserve a voice and compassion and empathy, eye contact, a smile, not to put anybody in any harm's way, but just acknowledgement that they are there and that they exist.
I think something really impactful from that video too is when he says, "Am I homeless?" Right? And I think that's the experience of many people who experience homelessness too. It's not necessarily something that someone plans. It's someone who's evicted or is shifting apartments and looking for their next home, and maybe has money in their pocket saved, and then an unexpected expense arises, and then they don't have money for a security deposit anymore. They're staying with friends for a few weeks while they continue to look for something in a really difficult housing market, and maybe their pet or their children or something, or their friends are in maybe public housing, or some situation says you can't stay with friends anymore now. where are you going to go to? It's all of things that kind of pile up and are kind of the root causes that make someone live in this place too. I think the other flip side too is that while everybody's kind of familiar with what street homelessness looks like, there is homelessness that we can't necessarily see. There's homelessness that looks like you, looks like me. People are living, they're couch surfing, they're staying with friends and family, they're sleeping in their car, but they're getting up and they're going to work in the morning. The kids are going to school. They're living their lives to the best of their ability. They just don't have a permanent house to call home to. So I think a lot of times too, with when we think of homelessness, we don't necessarily capture the familial homelessness or people who don't have permanent housing or are unhoused. But maybe don't look like the image on the screen right now.
Also, one other point to mention is that Krista and I typically work with the unhoused population who may be living in a shelter. And as she touched upon that, somebody could be what we call doubled up or couch surfing, which means that there are more than one household living in that property. And that is also another form of homelessness. An individual could maybe be a victim of domestic violence and find themselves unable to stay in their property any longer. And that's just a whole nother presentation in itself. But that is also a very highly prevalent form or way that we see individuals in our office as victims of domestic violence who do not have a place to stay, a safe place to stay for themselves, their children, and even their pets. So we throughout this presentation, you're going to see a few photos, and these photos are photos that have been taken by one of our day shelters here in Lackawanna County in Scranton called Community Intervention Center. Krista and I, although we are from different organizations, we both partner with all of the different nonprofits in our area, especially those who do receive funding from the government to provide these housing services. Community Intervention Center is one of the agencies. So as you see these pictures, they're anonymous in that we're not going to see into individuals, but we're going to see some of the actual living conditions that folks have found themselves in. And some of these are under bridges, some of these are by trails, and some of these are just in the densely populated woods that we see in the shrubbery that we see. So one of the other things that we wanted to briefly touch upon is what's called a point in time count. Some students who are here may be familiar with the point in time count because we do sometimes use volunteers to collect those numbers. And what that is, it is a mechanism to collect the number of unhoused and shelter populations on one given night. One of the coldest nights of the year, on the last Wednesday in every January, we do collect data. And that's what's called the point in time. The entire United States will actually do the same. And we go out to the trails, we go out to where the people are staying, and we also meet them in the soup kitchens and the shelters, wherever we need to go to collect this data. After the assessment, we do take it as an opportunity to provide services and kind of do like a mini assessment to see what else we can do to help them with. But just to briefly mention that our most recent publicized data of 2023, we did see 35 unhoused population individuals in that group who were unsheltered, who were living in various regions. A total of 234 individuals is who we counted that night, and that includes emergency shelters, safe haven, and transitional housing programs. So 234 in that one given night, of which 35 individuals were living outside on one of the coldest nights of the year. Our collaborative has done a really great job to fight for additional funding so that we can support those individuals. And we actually were just awarded $3.8 million to support this, which is about a $250,000 increase to support our community and to make sure that everybody has a home.
I think one of the interesting parts too that we'll touch on a few times tonight too is what does trust and what does meeting people where they're at really look at too. And the point in time count is a really great way to illustrate that too. In the point in time count, we're going out and we're asking people who come into our agencies that day, where did you sleep last night? Are you experiencing homelessness too? That's a hard question to answer for a lot of people, right? Is that something that I'm at terms with, that I'm willing to grasp with too? And what is the fear that comes along with someone asking me that question? Am I going to be in trouble? Is there some sort of repercussions that comes with it? If I have children, does that mean that children and youth are going to get involved, or there's going to be some sort of larger conversations at school if I answer that question yes too? So I think it's going back to Jess's original point to really building trust with people to say that we're here to serve you, we're here to help, we're here to provide the services that you're entitled to, and we're going to do that judgment free and help you along the way is important in addressing homelessness too. It's apartments, affordable housing is a large piece of that puzzle, but the trust and supportive services is equally as important.
The SLCOC stands for the Scranton Lackawanna Continuum of Care, which is what we call our collaborative of partner agencies who receive funding from HUD as well as interested parties and groups in our community. We support what's called a no wrong door approach. And what that means is that an individual or household can come to any of our organizations to get the same assessment, whether they go to my office, Chris's office, or any of the other offices. We all share the same database, and this is very important because there's no surprises. There's no need to keep on retelling their story and opening up a wound. It's pretty traumatic. We do know that if a family does become homeless or unhoused, that is causing a lot of trauma and a lot of changes to their brain mechanisms and chemistry. So there's so much more that goes into homelessness than what meets the eye. Some of these photos, again, do show the living conditions of individuals in our community. And as you can see, some of them are nice and neat, some of them are not as much, but at the end of the day, they create what is really communities. When individuals come to us and may enter in one of our programs, one of the biggest struggles, I think, to speak for both agencies, is that they want to bring their friends with them. They want to bring their family with them. And it's not because they want to have a party. It's because these people have gotten their back, had their back for years upon years while they were living under the bridge. And at the end of the day, they want the same for them, right? That's kind of what we want for everybody, is just to be able to have a home. So we encourage those individuals to really, let's set you up, and then we'll work on setting that person up as well. Another thing with the no wrong door approach is that there are so many agencies that provide various services, and we know everybody. We know everybody in the community, as some of my colleagues are here tonight to support us and support this mission, because we know each other, we support each other, which means that I can also pick up the phone and say, hey, I have somebody who's struggling right now. Can you meet with them for 5 minutes? Most recently, yesterday, I was working with an 18-year-old who is currently in school in one of our local school districts. And this person has been spending their nights on a porch outside. And so been trying to work with finding this person housing, and was able to pick up the phone and talk to another organization and try to collaborate a way that we can get this person quickly housed in a program with supportive services while they're currently spending one night after the other in a hotel. But this person is still going to school. This person's still doing, what they need to do to survive, and, kind of keeping that consistent. So that no wrong door approach, we truly believe it's a game changer for our community.
I think the other thing about a no wrong door approach and kind of working together too is that we all share a similar philosophy that we want to achieve the goals of the person, right? And home is defined differently, I bet, for everybody in this room, right? When I say home, I'm talking about my parents' home. I'm 30-something years old, right? I have my own house, my own kids. When I say home, I mean my parents' home. I'm sure many of you would say your apartment, your dorm room, your childhood home, your home away from home, your grandparents' house, whatever that's defined for you. And all of those places look really different. differently. So I think respecting what a home is to people too, and really understanding too that to some people, going inside to have a home can be really triggering, cannot be what their goal is for so many reasons. Two of the most significant being mental health issues or substance use disorder too. We had worked with a gentleman for several years. His name was Billy, and his daughter had passed away when she was a teenager. When she passed away, him and his wife divorced, and he couldn't go back to their home. He never stepped foot back in their home. Through his divorce, through the loss of his child, he lost many of his friends and family members, and eventually became homeless and lived on the street for decades. Billy stopped by for food. We got to learn him a little bit through getting food packages. We worked with him. We said, hey, you qualify for all of these programs, right? Not interested. He wanted to stay outside. Going inside again to him was too triggering, and the mental excruciation that he would experience in having a home again just wasn't worth the physical extremes that he was exposed to too. So we think it's really working together to say, okay, how can we keep Billy safe? How can we give him what he wants? How can we give him the tools to keep him so that he can be warm on really cold nights and come inside, but really work with him, get him connected to mental health resources in the meantime and work through it.
Another mechanism that we just want to briefly touch upon is what's called a housing first model. And this model is an approach that prioritizes providing permanent housing to people experiencing homelessness, and thus ending their homelessness and serving as a platform from which they can pursue a personal goal and improve their quality of life. So what that means to me is if I'm going to be meeting with somebody, the Billies of the world, I'm going to get them into a home first. I'm not going to say you have to go to rehab. You have to, get your liver checked. You have to meet with my therapist that we have in another department. Because at the end of the day, my primary concern is to get him safe and in housing. That's what I would consider as housing first. And throughout the term of the individual being in the program, I'm still not going to mandate that they have to do any of the have-tos, right? I'm going to ask him, what do you want to do? And then when he's ready, or when they are ready to say, yes, I am ready to speak to a therapist. Yes, I am ready to go to rehab. I will help them along the way. There are countless times. There's one person in particular who's still an active client, and we are getting ready to move them into subsidized housing, which is a big deal. They were, I want to say, the second person in this specific program, which means that they joined about 25 years ago. And I cannot tell you how many times I have driven them to rehab and picked them up a few hours later because they chose that they didn't want to stay. And at the end of the day, it's dignity of choice. And he was able to make his choices for himself. And I'm going to respect that. And I'm going to keep my personal opinions to myself because he can choose what he wants for himself. And that's what I believe is housing first. We do see individuals in an array of different ways when they come in to talk to us. And there's many times that they come in and I say, hey, I know we were supposed to have a meeting, but why don't I just make us a pot of coffee and just chat? Because that's what they needed that day. And I want them to feel safe and secure and knowing that I'm a place that they can go to. We are both places that they can go to and feel safe and feel heard and feel, that they're cared about because they are.
I think what's interesting about housing first too is if we look at what's called Maslow's hierarchy of needs too. So are there any psych majors in the room? No, a couple. Okay.
Don't worry, it won't be quiz.
So Maslow's hierarchy of needs basically says that in order to move up the triangle, so if we're starting at the bottom of the triangle in the physiological needs too, you can't go any further up that triangle until those needs are met too. So unless you have food, unless you have water, unless you have shelter, there's no further up you can't go. You can't feel safety. You can't have positive social experiences. Not that you can't have them, right? But you're not going to fulfill them to the best of your ability too. So you have your physiological needs met, then you can get to safety. So what makes you feel physically safe? What makes you feel financially safe? Having gainful employment. What makes you feel psychologically safe, right? Maybe having that conversation and going to therapy or getting your mental health needs addressed. Then we move up the triangle again. If we feel safe, our social need for love and belonging can come into play. We can interact with our friends, our family members, our community in meaningful ways on both parties' ends. Then we can go up to self-esteem. When we're secure in our social needs, we hold ourselves in high self-esteem. We feel part of the group. We can contribute. We really feel admired and respected. And then at the top, and let me know if anybody's gotten here, to self-actualization, really the peak of it too, we can act with our values. We have a higher purpose. We're feeling really good, and we can kind of go about our day too. So all of this to say, really, who's ever been panicked and made a decision and then later said, like, I don't know why I do it, I just freaked out, right? Or like, I panicked and I did this. Imagine living like that all of the time, right? That's how the brain functions. That's how the brain processes when your physiological needs aren't met at all too. It's hard to make good decisions. It's hard to move into that role of safety and really say, okay, yes, I'm gonna do this because it makes sense today and it makes sense long-term. The brain isn't capable of doing that.
Mm-hmm. I wanted to share with you Dan's story. So Dan is an active participant in one of our programs, and he agreed to share his story with us. Dan's experience of homelessness, and I do want to also qualify, I don't usually put this many words on the screen. I know that that's like PowerPoint 101 not to do, so I apologize. But I thought that this was important. Dan's experience of homelessness alternated between living outside, couch surfing, and sleeping at emergency shelters in Scranton. When asked what this period of his life was like, Dan stated that his homelessness was too difficult to describe and attributed financial instability as the primary cause of his homelessness. Dan shared that the only thing he looked forward to was a hot meal at St. Francis of Assisi Soup Kitchen. Dan also benefited from Keystone Mission and other local charities while being unhoused and is continually grateful for their support. Life began to improve for Dan in 2018 when he approached UNC's Community Services Office in search of rental assistance. Dan was identified as chronically homeless, referred to permanent supportive housing, and assigned a case manager. Within 1 month of visiting UNC, Dan's case manager helped place him in his own apartment. Dan also benefited from Catholic Social Services St. Anthony's Haven and Community Intervention Center's day room while awaiting an apartment. Today, Dan continues to maintain his own apartment and enjoys fishing and drawing. When asked what the biggest factor in his success was, Dan said, "The biggest part is having a place to live and somewhere safe to go." Dan said he would not be where he is today without his loyal case manager and financial support through permanent supportive housing. Dan is currently interviewing with several local stores and is optimistic about reentering the workforce. So this was actually publicized last year, and since then he had a job interview with Giant Market, and he has been employed since then. So really excited, and he still continues to work with our case manager. But when Dan first came in, I mean, he's going into an office space. And I mean, like it's an office space. It's not just like we're going to see him at the park. At our office, you know, he is coming to an office and asking for help. One of the most vulnerable things anybody could ever do. And I give him so much credit for taking that first step. So since being able to come in, and all of our staff and all of our buildings are very familiar with the criteria for various programs, so we try to identify the perfect model for that individual based on their needs. Again, we do implement a housing first model. So although somebody might be struggling with addiction and not currently in recovery, that's fine because we're waiting for them for when they are ready. And whatever their needs are, we work with them. We do goal setting and action plans to meet the person where they're at. And we both identify, both the case manager and the client will identify ways to achieve those goals and what their goals are. We look at the whole person because that's who's in front of us.
So how do we solve homelessness? It's a great question that I do not know the answer to. The obvious answer is build houses, right? Build more housing for people to go into, build more affordable housing. Again, that's a big part of the equation. The housing market right now, pre-pandemic, but is really exacerbated post-pandemic too, is unaffordable for a large percentage of people. Julie had mentioned the living wage report before too. If you really get to take a look at that too, to understand, we have the minimum wage in Pennsylvania, $7.25 an hour. In order to live comfortably, if you are a single parent, a family of 3 in Scranton, Pennsylvania, you need to be making around $20 an hour. I think that number is, look for the report for the exact dollar amount. But what does that look like? So I think really what a big takeaway would be is that homelessness is a symptom of many different diseases that exist in our society too. So if we have a cold, one of our symptoms is a runny nose. Someone hands you a tissue, your runny nose is taken care of for that minute, right? But there's still the cold that's in those germs or that virus that's in your body too. I think that's a really great analogy to what homelessness is too. Homelessness is the symptom of a lack of access to affordable housing. So is it the housing stock? Is it the affordability of it? Is it the politics in play and what the housing market looks like in a community? Is it low wages? So people might be working full-time jobs. There's people who are working full-time, making minimum wage, and still can't afford to pay for an apartment. It's access to quality healthcare too. So is it affordable? Is it quality healthcare too? Did someone have a medical issue that exacerbated that they weren't able to take care of too, that affected their finances, that affected their ability to gain employment, and affected their ability to live independently? It's public policy. What are the systemic policies in place that affect generational poverty, that affect education, healthcare, housing, all of the things really that are on these routes can be linked to that as well. Is it abuse? What were someone's experiences? Is access to quality education? Is it systemic racism too? Has anybody ever seen the exercise where a group of people will line up and someone will say, take a step forward if you're white? Take a step forward if you're a man. Take a step forward if you have a college education. Has anybody ever seen that? Do you know what I'm talking about generally? Okay. So I think that's a really great illustration of the systemic issues that give people so many advantages in life too, or so many disadvantages too, that people start off at the starting line when there's people already at the finish line when they're born too. I think taking all of that into account too, it breeds to the upper part of this tree. So what grows from the systemic issues too? It's homelessness, it's violence, it's crime, it's hunger, it's addiction. It's all of these things, the symptoms that we see and that we're working to address too. And it's great, we have to address homelessness, right? The people who are in need of houses need housing now too. But I think it's really important when we talk about advocacy and policy and how do we change the systems in place too, so that we have a really great system too, that all these issues are addressed and the homelessness decreases because of them.
Really, I think Krista said it very well. The only thing to add to that is just continue to find ways that you can be the voice for the voiceless. Continue to find a way that, different ways and techniques. And there is no answer. There is no magic wand yet. But hopefully in our generations and in our lifetimes, we will be able to find an answer. We're going to open it up now to any questions.
Bring a microphone.
Okay.
Questions?
As of 2024, how big will you say the homeless population in order to VA or just in Scranton?
Yeah, so the numbers aren't published yet, but I do have an insider report that they have increased a small amount, which is expected based on what we've seen with inflation and shrinkflation. So we are seeing a smaller increase, but not as drastic as some other communities. I'm sorry? Okay.
How exactly do organizations like yours go about getting any kind of funding in order to run these programs?
Yeah.
From the government or from
Absolutely. Sure. So I think both of our organizations do receive federal funding county funding, state funding, local funding, foundation funding, any funding, any donations. We have a very successful network of colleagues who advocate for funding. We do go to Capitol Hill and we show them the needs that we see. What's called, the thing we had talked about earlier, the report, the point in time report actually goes to Congress every single year, and they can see live numbers of what we're seeing in our communities. So there are many, many different ways that we do try to get funding to support our causes. It's never enough, but we do very well with what we have, I would say.
Yeah, I agree. It's a puzzle of any funding stream that really you can think of too. And I think there's a decent amount of funding to address the issue too. But of course, expansion of shelters or serving more people in a rapid rehousing program, for example, there is a finite dollar amount, right? So I think it's the system that we live in. We know it's broken. We have to live in it, right? So I think that's where the collaboration of agencies becomes really important. Here's what I can do. Jess, what can UNC do? What can your agency do? How can we work together to get all the pieces with the dollars and the programs and the availability that we have?
Thank you for your question.
Okay, so you said that you go once a year to cover the homeless?
Mm-hmm.
All right, and that's, how much of the trail do you cover?
So we work with, can I take this?
Mm-hmm.
We work with our local day shelters or hospitality shelters. And throughout the year, they focus on doing outreach for the community. So when it's time for the count, we really rely on them to know where the pockets of populations are.
So you don't have like a schematic of where you start, and there's not somebody that goes.
Every single year it changes.
So you're saying 234 and 35 of them are outside?
35 were outside, and 234 is including anybody in shelters that night.
So there's, okay, because it seems like there's a lot more.
It does. It really absolutely does. And that's only one night. So
Yeah, I understand. So it's
Yeah.
once here, one
Mhm.
night, you go out and count.
yeah,
that's
and
the count.
we're also very mindful that that night is the coldest night, one of the coldest nights of the year. So we expect that during the summer months, the numbers are higher. So just on that one night, and it's a HUD mechanism to collect that number. So that's the night that they choose.
So if it's not an accurate number, does that affect like services provided and funding?
I think
It
it's
seems like there's a lot more than that.
Yeah, I think it's the best tool that exists, right? So counting the homeless population is kind of like how do you do it, right? And when we talked about trust earlier too, asking someone if they're homelessness, we know the answer is yes for more people. You can't, not necessarily too, right? And I think there's that trust element, right? So going in and saying, hey, you're on a tent, I'm not gonna assume that you're homeless, right?
So then it's people that show up at these places that you're talking about is where you get your help from.
A combination. Yeah, so unsheltered, people who are seeking services, like we said, the outreach that happens year round, going out into the encampments and kind of doing that count.
Okay, just curious.
Yeah. So yeah, to answer your question, both, all the things, whatever we need to do.
Okay.
Yeah.
I was curious about the quality health care as far as where we stand right now as far as public policy and assistance for that.
Yeah, that's a great question. So I know there's some really great providers locally. Scranton Primary comes to mind, the Wright Center, the Aaron Center. We have some really great local providers that provide services to anyone in need of them too. I think in a post-pandemic world especially, it's a capacity problem, right? I think we're not exempt from anywhere else in America of saying, do we have enough nurses? Do we have enough physicians? Do we have enough skilled workers to be able to serve all of the people who need those services? So we're fortunate to have so many providers locally too. I'd say it's really like a capacity, a workforce issue, and that's circular, right? So here's the workforce issue, here's the capacity issue, the healthcare issue, the poverty issue, and kind of around we go.
Yeah, and to add to that, there are some mechanisms. So United Neighborhood Centers has what's called a community health and aging department, where we have health navigators who can meet with people wherever they're at, whether it's in their home, whether it's in the doctor's office, whether it's behind a building, and they have done that to help to mitigate some of those concerns. And again, meeting them where they're at. But we focus on what's called the social determinants of health, which are really anything that will attribute to poor or good health, including housing, food, childcare, transportation. There's just a whole litany of social determinants of health. So that's another way that we can try to work with some of those health concerns that we see, and in order to really focus on getting somebody away from going to the emergency room visits, and rather to focus on preventative care and ways to set themselves up with a doctor so that we can both cost savings and also health savings.
I think, again, it's where trust comes in, right? It's where those supportive services and case management are really important too. I think many people have stories of, I went to the doctor and they weren't listening to what I said, or they didn't do anything for me, right? Why am I going to go back for this, or why am I going to take back for that? And it could be such a small experience too that can prevent someone from seeking healthcare in the future too. So really, by building trust, by having case management and supportive services to say, why don't we ask these questions? Why don't we come, prepared with this to kind of navigate what can be a scary process, can really help somebody to kind of transcend their past experiences.
Yes, my question deals with Dan's story, which was a great story. But I've been asking around about the homeless, and I've been told that in order to get to the point that Dan was, that you have to have your Social Security card and your birth certificate. So someone told me that I'm always trying to help somewhere that I could offer $20 to this group, and they could take the person downtown if they're born in Pennsylvania to get their birth certificate. And they can get their birth certificate in the day. However, the Social Security card is the one that causes the issue. And in order to get to the point that Dan was, you have to have both of those documents before you can move or begin to move out of homelessness. Is that a correct statement, Dr.?
So it could possibly be a correct statement, but I also invite anybody who is working with somebody who is coming up against that barrier to give them my name and number and have them call me, because that's not what should be happening. What should be happening is that we help the person to identify, we will identify with the person if they are eligible for that program. And some strict criteria is there, which is that they have to have been homeless for a minimum of 1 continuous year, or 4 or more episodes in the past 3 years that total up to a year, which it's a lot. They don't need their identification, because we understand that if they're living outside, the chances of them having the identification, things get stolen, things get ruined. They can join a program and be in the program for up to 90 days while the caseworker works on getting their identification. In addition to the time frame of homelessness for the program that Dan is in, they have to have a disabling condition that's going to keep them from sustaining or maintaining work or employment. They don't have to have Social Security. Some people may choose to work part-time afterwards, like Dan did, and that's great because we will help them to achieve those goals. Some of the red tape is the things that make me cringe. And that's why I do welcome anybody who's hitting any of those barriers to reach out to me, because I'm very well versed with some of those ins and outs and ways to break down those barriers, because the barriers are really what are awful. So I'm sorry that person went through that, but if you want to see me afterwards, I can get you my card. Thank you.
I think that's a really great example too. So you don't necessarily need identification to come in immediately, as Jess said, to a lot of the housing programs. And that's what the agencies are here to do, to support you in getting your birth certificates, your Social Security cards, because you do need both of those documents to apply for public housing. That may be what they're speaking to too. And there's barriers in that, right? If you're homelessness, where's your Social Security card going to be mailed, right? Again, that's why it's so important to reach out. Call us. You could use our address. We'll take your mail. Stop by. We'll let you know if you have any. CIC will accept mail for people. UNC has done it before as well, too. I think it's calling and saying, like, here's my situation. Is this true? How can you help? What can you do? And sometimes the answer is no, or we can't help, or this is what it is, and we wish it wasn't. but really saying what are the little things that we can help to kind of push you forward.
And I see some other hands. I just want to also add another technique that many of our staff are trained in is what's called SOAR. And what that does, it helps the individual primarily to get Social Security benefits, but it also helps us to determine to make their eligibility, to show their eligibility for the programming, because we do see the times that they're homeless and the episodes of homelessness that they have gone through. So we can help that individual to identify, these are the times I've been homeless. Maybe I lived in Florida because it's warmer down there in the winter, and I come up here in the spring. And we can get creative with that to get that eligibility and the criteria as well. We just need to kind of know beyond a shadow of doubt or in that direction that they're eligible.
So what do you see as gaps in the current resources and services locally? What do you think there needs to be more of, or what's not getting done by some of the organizations that we have? And then the second question, tacking on to that, for me would be what you'd be seeing as helpful coming from the city of Scranton. What could we do better to assist in that?
I'd say that there's a gap in the availability of coordination of mental health care, right? And again, I think it comes down to largely a capacity issue. There are so many people who are in need of true mental health services, and the wait lists to receive those are very long. We see that too. So when and we go back to that Maslow's hierarchy of needs, when someone's in a mental health crisis, it's really hard to kind of move forward for that or realize their greater potential when that exists too. I think a stronger collaboration with the medical systems that exist too could be really great too. Often there are people who are being discharged to the street, and then their medical issues, whether it be mental health or physical health, are exacerbated immediately upon release too. But there may not be a shelter bed available for them to directly go into too. So coordination of services there too. I think the Unsheltered Task Force that Mayor Cognetti has started is a great start to addressing some of this, and really the collaboration and coordination of services too. The unsheltered population is really a focus topic right now in Scranton too. So I think the police department, the city, and then the social service agencies working together to build that trust, to do that outreach, to have dollars, to have a plan, to help people to find that housing, to reach their own goals and what that looks like is going to be really important moving forward. So really the continued collaboration, dollars for what the next step is, and really a focus on that mental health and safety piece.
One other thing that I think is super important in our region is affordable housing. If you look at a 1-bedroom apartment out for rent right now, you'll be lucky you find one for $1,100. Usually with no utilities included. And as we had talked about, the minimum wage being $7 an hour, that's really not affordable. And not to mention if you need more than 1 bedroom or something on a public transit route. So I would say that affordable housing, which is different than low-income housing, it really looks at the market in your area and determines this is what is a good rent to charge. I think that's something that we need to take into consideration and advocate for more dollars in our community.
I have so many questions, but I think the most important thing is I'm listening to a lot of long-term solutions to a chronic issue. But what is the immediate plan? Obviously, we don't have enough shelters. There's not enough immediate resources to take care of what I see or what anyone else sees on a daily. How do we address an immediate solution? That means, how do we eliminate the tents? Or if we can't eliminate the tents, how do we provide some sort of livability to begin that process of uplifting the morale, the and the psychological effects of being homeless?
With the unsheltered task force that Krista had talked about with Mayor Connetti's unsheltered task force, one of the things that we are really trying to push is to add more shelter beds or a shelter structure. And when asked for me, you know, what I think is a solution, I say all of the shelter types. So, you know, single individuals, both men and women, intact families, single parent households, those who are under the influence, those who have a mental health diagnosis. I mean, that's like 5 right there. And so I don't know if she's going to take me seriously and create 5 shelters for me, but I think it's very much needed, as well as supportive services. I think to create a shelter without those supportive services, I feel like that's going to be lacking. And what I mean by the supportive services is whatever that person's goals are, what do we need to do to achieve that? It's not an immediate solution right now. Yeah, there is a huge gap right now. And also to add to that, there will probably always be tents outside. There will probably always be people choosing to live outside, but at the end of the day, it's their choice to live outside. But when they are ready to move inside, we will be ready to take them.
And I think the answer to what do we need right now, it's dollars, right? So we need money to make all of that happen too. And we need passion and support from the community too. So I think one of the great things is that the tents outside in Scranton aren't new. There's been unsheltered people living in Scranton for a very long time. We have documentation of that too. It's growing. That population is growing in a post-pandemic world too. But people care. People care about what is happening down there. People care about the people living in the tents. People care about where they're going to go and what services are available to them. And I think that's really inspiring to get the ball rolling, to have more advocacy and more dollars come to serve that population.
We're going to take one last question.
With the collaboration that you guys have with all the local organizations, you find collaborating with landlords because they are going to be a pivotal pawn for this piece. Do you guys have advice on that, or how are you guys working that with the housing?
Yeah, absolutely. So there's also a local, so it's the Scranton-Lackawanna County Housing Coalition, and a subcommittee of that coalition is a landlord subcommittee. Thank you. So they hold quarterly town halls where all of the landlords in the city that we have contact information available for are invited to learn about the social services, to learn about the programs we have, to learn about what living in poverty looks like and the supportive services that the agencies have available to work with landlords, to make renting to people who are living in poverty more attractive, to say, here's what we can do for you too. Here's what the reality is. Here's how you can give back to your community too, and still, serve whatever interests you in being a landlord too. So that's one effort that's happening too. And I know our caseworkers are working with landlords all of the time to build those relationships too, to say, do you have units? Are they available? Are you taking care of them, right? Can we step in and support in whatever ways that make sense?
Yeah, absolutely. Yeah, the landlord task force, it's not an easy task force by any means, because landlords many times are in it as a business model, and that's okay for them. We don't expect them to be counselors or social workers, but at the end of the day, we hope that they would be willing to partner with us and to try to solve some of this, and recognize that it's not just like we're putting somebody in an apartment. We're putting them in an apartment with a lot of supports and people who are going to be at their door every single week and seeing what we can do, and a number to call in the middle of the night if there's any issues. So there are steps in play. During COVID, a lot of our local landlords who we worked with moved out of the area. And so we're just starting to rebuild our list and to find landlords who are willing to work with us now.
So we have kind of run out of time, but I wanted to give you two a chance if you have any other final closing comments you want to make, things you feel like you got to.
The only thing I would like to say is I'm impressed that all of you are here tonight, and thank you so much for hearing our presentation, and I hope that you got something out of it. And thank you. Continue to do all the hard work and study hard.
I'll be quick. Just if you have any questions or for future conversation too, please feel free to give either one of our agencies or us a call, email, stop by. We're happy to talk.
I want to thank Krista and Jess for the work that they do every day. Just that there's wonderful social service agencies in Scranton. We've heard that we know that there are continued gaps, and all of us can be part of advocating for more funding and more support. I also want to say that there's a lot of discourse in our community at times. It's very knee-jerk reactions to these issues of homelessness. There's a lot of stereotyping that goes on, and what we heard tonight was personal stories, the human faces, the struggles, the underlying causes, and that's really the approach that we as a university are proud to partner with and to be of assistance in any way that we can be, but also want to again applaud you all for the work that you're doing. I know that there were questions that we didn't get to as well, so I know that we're happy to stay for a few minutes after and continue the conversation. So thank you all for being here. Have a wonderful night.